What causes diarrhea and how to stop it? Diarrhea, also spelled diarrhea, is the condition of having at least 3 loose, liquid, or watery bowel movements each day. It often lasts for a few days and can result in dehydration due to fluid loss. Signs of dehydration often begin with loss of the normal stretchiness of the skin and irritable behavior. This can progress to decreased urination, loss of skin color, a fast heart rate, and a decrease in responsiveness as it becomes more severe. Loose but non-watery stools in babies who are exclusively breastfed, however, are normal. What causes diarrhea? While diarrheal illnesses are not uncommon, most cases of diarrhea are preventable by careful hand washing and avoiding contact with contaminated surfaces. The combination of certain viruses, the most common of which is gastroenteritis, as well as bacteria, is responsible for 90% of the cases. Some specific viruses can cause both mild symptoms and more severe complications that may need treatment, like a staphylococcal infection or an infection from E. coli bacteria. Some of the common reasons diarrheal illness occurs are viruses. Most of these are caused by enteroviruses, rotaviruses and parainfluenza viruses. A vast majority of diarrheal illnesses are caused by enteroviruses, including rotavirus, adenovirus and gastroenteritis. Diarrhea is also caused by parainfluenza. How do you stop diarrhea? Avoid eating lots of processed food. Avoid hot foods. Follow a good fluid intake. Try bland or cooked foods, i.e., baby foods. Keep the child entertained. For stool more often, in children, stool softeners are used. This means putting some sweetened material in the toilet to encourage the child to have a bowel movement, or a soapy substance to clean the anus. These products usually contain vitamin D. Your doctor can advise you of medications to try, or if other ways to stop diarrhea are to be tried. There is no definitive answer, but there are some things that can help. Babies will often run a fever. This is when the body is fighting an infection. Taking Tylenol and Motrin to bring the fever down is the best way to help the child feel better. How to prevent diarrhea? If you notice that diarrhea is recurrent, make an appointment with your doctor. It could be a side effect of an illness or a chronic condition like IBD. Other causes of diarrhea are caused by dehydration or an underlying condition. For example, gastroenteritis, stomach flu or food poisoning can cause diarrhea. Diarrhea is sometimes a sign of the colon, or large intestine, being affected. You may experience some of the following signs and symptoms: pain in the abdomen with or without diarrhea, severe vomiting, an increase in frequency, a dark or bloody stools, hot and or sweating hands, unusual back or abdominal pain, changes in stool consistency. Diarrhea often causes dehydration and not to drink fluids, as your body needs water to prevent dehydration. Conclusion: diarrhea is a typical sign of dehydration and should be monitored closely. If diarrhea persists for more than 3 days, one should see a doctor. Further treatment should be considered if symptoms are not improved.